Married for 14 years, Bill and Carla Warner had an active, loving life together. Then Bill went into the hospital for a diagnostic procedure that changed and ultimately took his life.
He was a man who worked 14 hours a day, driving a concrete mixer. Lifting 50 pounds was nothing to him. And then he couldn't even lift himself up off the couch. The pain that he went through was excruciating.
Bill contracted CRE, an antibiotic-resistant infection known as a superbug, following an ERCP procedure at a hospital.
My misconception was that the equipment that was going to be used on Bill was sterile, and it's not. I had no idea that it wasn't. That was the biggest surprise to me.
Until now, long, flexible endoscopes like this one were only high-level disinfected instead of sterilized. That leaves the chance for contaminants to stay hidden on the scopes and be passed on to other patients. Now, new innovative technology like TSO3 opens the door for low-temperature sterilization of endoscopes to be used in a variety of procedures, such as ERCP and colonoscopies. Rick Rumble is president and CEO of TSO3.
As the organisms become more challenging to sterilize and as the bacteria become more resistant to the antibiotics that are used to treat them, if you have the ability to create a sterilizer that would effectively rid the instrument of these individual organisms, why wouldn't you?
The Sterizone VP4 sterilizer uses dual chemistries to sterilize a long list of medical equipment in a single cycle. What's new is the addition of multi-channeled flexible endoscopes to the list of FDA-cleared devices, which can be terminally sterilized in the sterilizer. The landmark inaugural use in the U.S. of this paradigm-shifting technology took place in June 2018 along the scenic Red River of the North in Grand Forks, North Dakota.
We offer a sterilized endoscope, a sterilized duodenoscope versus a high-level disinfected one. And the level of differences and the margin of safety for our patients there is no comparison.
Jenny Gibbs manages the Central Sterile Department for All True Health System. This community hospital has been on the cutting edge of technological advances, including reprocessing of endoscopes. Why would a rural community hospital take the bold step to be first in the nation with new sterilization technology? Gastroenterologist Dr. Israr Sheikh says the answer is simple: for their patients.
We believe in best patient outcomes, so because the data is so strong that it actually cleans the scope so well, we will be minimizing the risk of any sort of infection. We'll be ensuring that our scopes are clean enough and that none of the adverse outcomes that can be easily prevented will occur. So that would mean that patient care would be enhanced, and that would mean that it would be better for our generalized patient population.
According to the U.S. Centers for Disease Control, more than 2 million Americans are infected with antibiotic-resistant infections each year. More than 23,000 die. The CDC says by the year 2050, more people will die from those infections than from cancer. For those patients who contract CRE, like Bill Warner, only 50% survive.
Sterilization is critically important, especially when we're looking at invasive procedures for our patients.
Rose Seavey is a former operating room nurse who is a widely published, nationally recognized expert in sterilization and now consults in the areas of sterilization and high-level disinfection. Seavey was in Minneapolis, Minnesota in June 2018 for one of the world's largest infection prevention-focused conferences. She says medical devices are far more complex than they were when reprocessing standards were first established more than 30 years ago, and those complex devices are now being used for more invasive procedures like biopsies.
I certainly would not want to have an endoscope used on me that's going beyond my mucous membrane that is not sterile. And I wouldn't want that for any of my loved ones or any patients that are out there.
Jenny Gibbs agrees.
I want sterile reprocessing for every person in our community. I want sterile endoscopes for every member of my family and every member of anybody's family that I care about. It is absolutely essential. Life is sacred, and this is something that we can affect for the better of the entire country.
Across the country in North Carolina, Carla Warner celebrates.
I am utterly ecstatic because here we are 5 years later. We're talking about Bill's story. And I have spent the last 5 years, every opportunity that I was given to share our story And it's coming to fruition that we've made a difference. This is Bill's legacy. We've made a difference.
The challenge now? Educate healthcare providers and patients about this innovative technology so it can sterilize the scopes in your next procedure.
Think of a world where I would never meet Carla because her husband would still be alive. The procedure would have gone without complications. There would have been no infection. You see, that's what we live for.